session will start with a small first initiation. I want to give you how important it is for us to understand what we should know in diabetic foot and how we should take it forward. The goal, what we have a goal is preventing diabetic foot ulcers and amputations in Indian rural communities. Please make it a point. Urban people, metros, they have one or other way to get into this area, but rural people, it is very difficult. The theme, what we are holding in our center is how best we can prevent first ulcer. The entire globe has miserably failed to work on this. Nobody could prevent first ulcer in diabetic foot. Please work on this area. PGs who are there in this hall as a delegate, I want them to understand how best you can prevent first ulcer in the diabetic foot is the challenge, very important challenge. The basic knowledge is very important in diabetic foot. What is that? Am I going to cure this disease? Number two, why I'm thinking of this disease so much in last 20 years? Because of big number. What we need to know, what is functional limb? You need to understand what is functional limb. Limb is an organ. It is an ambulatory organ. So every human being requires lower limb for the ambulation. So this organ is getting affected in diabetes. So how I should address functional limb definition and how I can make a diabetic foot, if at all it undergoes any kind of surgery, how he can keep on moving. What is new science? Footwear science. Nothing is there in the medical curriculum regarding footwear science. We need to understand, if at all you are interested in diabetic foot and its treatment, you need to understand diabetic footwear science, which is very, very important. Everyone, physician, diabetologist, endocrinologist are interested to convey a message to the patient that do exercise, reduce your sugars. What exercise has to be done if foot is in danger? If foot is having neuropathy, vasculopathy, and immunopathy, and there is a fracture, we call it a Charcot foot, then whether he has to do exercise or he should not do exercise. Very important issues to be addressed. Basic knowledge. What are the myths and what are the facts? What myths we are carrying along with us that wound is going to heal with doing dressing? No. Dressings don't heal the wound. Properly selected dressings enhance the body's ability to heal the wound. Otherwise, normally concept क्या रहता है? Patient आता है तो बोल देते हैं कि नहीं, dressing करते रहो, heal हो जाएगा. No, this doesn't happen in diabetes. Everyone need to know connected. We are looking at risk foot, high risk foot, very high risk foot. So we need to know something new screening method by which we can pick up early to unlock the behaviors of the diabetic foot. Why the foot behaves like this? So we need to know foot behaviors in diabetes and we need to plan salvage. Now look at outcomes of early reference. If somebody refers you a diabetic ulcer, day 1 and day 100, it is healed well. Why? Because we are educating the patient, we are taking care of the wound, we are taking care of the microbiology, infection, vascular supply, metabolic control, and the most important is offloading. All these important parameters, 6 pillars, have made a big difference in management of diabetic foot, but the late reference, there is a word written there, gangrene. If you are not following these 6 pillars in the right way in your practice, it ends up with a gangrene. The most important issue is late reference. You keep on working on first picture, long duration, you have not assessed any of these pillars and it ends up with gangrene. Then you blame diabetes for that. Never blame diabetes for that. It is these pillars were not followed properly, timely, so it has ended up in gangrene. We want to empower all rural healthcare providers, including ASHA care workers we are working on. The strategy is to give them knowledge of challenges in diabetic foot. What new clinical presentations are going to come up in your day-to-day practice? And what is the new prescription you are going to write to the diabetic foot patient? Very important new prescription you are going to write in coming 10 years. Now, all of you know the moment the ambulance moves in Lucknow, there is somewhere accident or heart attack or there is an emergency. But we need to understand there is a foot attack. A trivial trauma to the diabetic foot, you should treat it as an emergency. And you need to get connected. There is a helpline, you can get touch, and we have to convey this to entire our North Karnataka and Karnataka, where people keep on calling me and we work on this. We work on WhatsApp, and now we are starting our own app. Shortly, we will be having an app to convey all the people, including patients, they can get connected directly and we can try to save the things.